Hello guys, thank you for joining today's session. My name is Katherine Lin. I'm an accredited practicing dietitian, and just in case we have not met, so first of all, I would like to thank you for your support and also constantly referring patients to me. During today's session, I would explain some of the common clinical reasons for referrals to dietetics, and also I will introduce this new form which we're going to start using. It's called the Malnutrition Screening Tool, MST. So I would explain in terms of how to complete the form and also how often we need to rescreen patients using this form. Our government has been collecting all sorts of clinical data, and the most recent data on the prevalence of malnutrition is around 30 to 40% of all hospital-admitted patients across Australia. So the prevention and management of malnutrition helps with the recovery, with the patient's recovery, reducing the length of stay and hospital readmission, and also reducing patient's mortality. Well, malnutrition is commonly seen in patients who's been admitted with poor oral intake, poor appetite, ongoing unexplained weight loss, difficulty in eating or drinking, which also includes poor dentition, which leads to eating fatigue and lack of interest in food. People of frailty or impaired mobility, such as hip fractures, may have limited access to food preparation and or shopping. So they would carry higher nutritional risks. Some acute or chronic illnesses and medical treatments can affect appetite or oral intake too. For example, cancer treatments. Both chemo and radiotherapies can hugely impact oral intake. And patients with cognitive decline, delirium, dementia, Parkinson's disease, and stroke, for example, can impact a healthy dietary consumption. Also, people with unstable diabetic control, any pressure injuries at staged more than 2, or if the pressure injury is hospital acquired and unstageable, should also be referred to dietitians. Other chronic conditions include liver cirrhosis, which often comes with muscle wasting and poor oral intake, and renal impairments, both acute and chronic. For newly diagnosed renal patients or those with hyperkalemia or malnutrition diagnosis or requires nutrition support, should be referred shortly post-admission. All the above-mentioned clinical reasons are categorized as high priority for dietitian referrals. And I've also come up with this document here, Evidence-Based Demand Management Toolkit for Dietetic Services, where I list out most of the clinical reasons and categorize them for prioritization of my workload. Some people may require higher nutritional requirements for some particular reasons. For instance, post-surgery, trauma, burns, pregnancy and lactation, and anyone with respiratory conditions. This malnutrition screening tool, the MST, is a reliable and validated tool. It screens all the patients upon the admission to the hospital and monitors the nutritional status and the severity of the malnutrition throughout their hospital stay. The purpose of this form is to identify anyone who is or is potentially at risk of malnutrition, so we can better manage and prevent further deterioration in their nutritional status during their stay with us. Well, this form is usually completed by our lovely nursing staff and or the allied health assistants for dietetics. Well, it asks two simple questions. 1. Has the patient lost weight recently without trying? This question applies to the most recent 6 months. The options includes no, and if they say unsure, you can further ask them if they've noticed any change in their clothing size, if their clothes or rings become looser. 2. Has the patient been eating poorly because of decreased appetite? You can further prompt them by asking if they are consuming only or less than 3/4 of their usual intake. And lastly, you add up these two scores and finish this form with a date. If you turn to the back of the form, anyone with a score of 0 or 1 is clinically identified as being at no risk of malnutrition, and they would require weekly rescreening so we can pick up the first signs of malnutrition and prevent it during their stays with us. And anyone who scores 2 or more should be referred to dietitians. Get a bread mask sticker with a reason for referrals, as we've discussed earlier in the session, into that folder with all the referrals to allied health professionals. And lastly, documented in the progress notes or medical notes to indicate that you have completed the MST form and the referral to dietitians. Food charts and weekly weights should be commenced. The weights sometimes can be requested more frequently as per the medical professionals. And dietitians would complete further malnutrition assessment in more details to determine the severity of their malnutrition and implement strategic interventions accordingly. And they should be rescreened on a monthly basis using the same MST form. So the conclusion is the MST form should be completed for all patients upon their hospital admission, complete the referrals to dietitians, and rescreen them during their stays with us. So hope all of these make sense to you guys, and if you've got any questions, you can always leave a question in the comment section below or wait when you get to see me in person at work. I will also include my email address in the description box below. So thank you very much for your attention, and I'll see you later. Bye bye.